Hi, good afternoon, everyone. I'm Serene, one of the scholarship officers with Healthcare Scholarships and Talent. To start off, a warm welcome to the Healthcare Scholarships Virtual Experience 2021. For some of you who have attended the earlier sessions, welcome again and thank you so much for joining us for this segment. Throughout the 2 weeks of virtual events ending on 3rd March, you will get the opportunity to participate and interact with scholar ambassadors, scholarship officers, university partners, and professional representatives from various public healthcare institutions. Do note that we have an ongoing leaderboard and game section for participants to win attractive prizes, such as Universal Studios Singapore One Day Pass, Disney Plus subscription, Grab food vouchers, and many more. There are many ways to earn points, such as attending programs, asking questions, and playing our daily games. So, welcome to Walking in a Healthcare Professional's Shoe. In this interactive program, you will play the roles of the various healthcare professionals that are involved in a patient's route to recovery. Look out for the poll questions that will be on the right of your screens. Do vote for the answers that you think is the most appropriate. We are proud to share that our scholar ambassadors planned and executed this whole program. Do also note that the top 3 participants with the correct answers will win $10 Grab food vouchers. So before we begin, if you have any questions for our speakers, please feel free to type it in the Q&A functions. If you'd like to direct your question to a specific speaker, please indicate it in your questions. Lastly, if you see questions that you're interested in being answered, please upvote those questions and we will have a short Q&A at the end of the session. So without further ado, I'll pass on the time to the first station for Grace and Jonathan. Thank
Hello,
you.
welcome to Walking in the Healthcare Professional's Shoes. I'm Grace, a Year 1 NIP nursing student.
Hi everyone, I'm Jonathan. I'm a 4th year SIT Physiotherapy student.
Yeah, so the objectives of this program are to understand how healthcare professionals work together in providing patient-centered care, understand the breadth of knowledge healthcare professionals use when working with patients, practice critical thinking skills to derive the best options for patients. So without further ado, let's get started with the icebreaker, Guess My Profession. So the games is to look at the pictures and guess the profession. You have 20 seconds to do so. The poll is on the right. So the hint is also to look at the subtitle. So this is the first question. And here are the options. So what do you think the profession is? Okay, so we'll close the poll now. The correct answer is actually medical social worker. So they support patients and their families by providing psychosocial assessment, develop discharge plans that meet their post-hospitalization needs, and help them to cope with financial, social, emotional, and health issues. So this is the next question. And here are the options. You have 20 seconds as well. Look at the subtitle. Okay, so we'll close the poll now. And the correct answer is actually occupational therapies. Yeah, so they design, implement activities to ensure maximum recovery and achieve optimum independence for patients who are physically impaired or who have lost their disability to perform daily tasks. So this is the next question. And okay, we'll close the poll now. So the correct answer is actually nurses. So they are highly skilled and well-rounded profession with diverse responsibilities. They manage patient care, to train the caregivers to provide basic care, educate patients and their families, assess patients' physical and mental well-being, perform clinical procedures. So this is the next question. Okay, we'll close the poll now. The correct answer is actually physiotherapies. Yes, so they help people who are affected by injuries, illness, or disability through movement and exercise, manual therapy, education, and advices. So this is our last question. Okay, so we'll close the poll now. The correct answer is actually diagnostic radiographers. So they specialize in delivering high quality imaging service that aids in the diagnosis of illness and injuries. So now I'll pass the time to Jonathan to give you more insight for other allied healthcare professionals.
Thank you, Grace. So aside from the 5 allied healthcare professionals that she has shared, we also have 8 other allied healthcare professionals. So I'll just be briefly sharing with you all some of the descriptions that these healthcare professionals do. So for dietitian, they assess and prescribe appropriate dietary treatment and nutrition care plans for patients. And then we have the respiratory therapists who plan and evaluate and integrate the cardiac and pulmonary care for patients suffering from respiratory conditions. And next, we have the doctors who assess and treat patients who suffer from defective eye movement and coordination. And then we also have the prosthetists and orthotists who provide care for patients who require artificial limbs or corrective and supportive devices to enhance their quality of life. And then next, we also have the speech therapists who diagnose and provide treatments for patients who suffer from voice problems, cognition, or swallowing disorders. And then we have pharmacists who dispense and counsel patients on the use and effects of medications. And next, we also have the podiatrists who diagnose and treat patients' condition of the feet and lower limb, such as bone and joint disorders. And then we have the radiation therapists who use state-of-the-art computerized equipment to accurately administer the prescribed radiation dosage. And lastly, we also have the healthcare administrator, who is not part of the allied healthcare professional, but they do a very important role in shaping policies and direction, as well as providing administrative support for clinical department. So if you'd like to find out more about what each of these allied healthcare professionals do visit the Care to Go Beyond website to find out more. So essentially, this whole icebreaker is allow everyone to understand that our healthcare professionals are part of a multidisciplinary teams that provide a holistic support and care to each patient. And so not just understanding each profession by itself, and understanding that we work as a team to provide the best care for patient. And then subsequently, we're going to have run through a series of stations to allow you to walk in the shoes of the healthcare professionals through various stations. Okay, so we will start with a case study. Okay, so this case study, we have Mrs. X, who is a 55-year-old Grab driver. So after her husband lost his job due to COVID-19, Mrs. X became the sole breadwinner for the family of 4. So she also has diabetes. So one day, Mrs. X missed a step and fell down the stairs. So although she felt some pain in her ankle, she managed to get up and went home. But once she was at home, her ankle, Mr. X helped to put some medicated oil on ankle and provided her with the plaster for the cuts that she received. But Mrs. X refused to seek medical treatment, and she felt that it was too expensive and the medicated oil would do the trick. But after a few days, her ankle was not getting better, and one of the wound was actually started to secrete some slimy pus. So she decided to visit the polyclinic next to her house. So this is the case study. Okay, so just to give context into what you'll be going through in the subsequent stations. Okay, so next, I'll just be introducing the characters who will be taking you through the journey. So we have Cheryl as the patient, Mrs. X, and then we also have Amy as the narrator. Okay, and then at each station, there's a station IC who will be representing the healthcare professional. So just to briefly run through the flow of programs so that give you a better idea of what you are going through at each station. So in the first 2 stations, you'll be in a polyclinic setting. Okay, so you'll be going through nursing triage and the diagnostic radiographer. And then subsequently, Mrs. X will transit into the hospital, will be admitted to the hospital. And then from station 3 to station 7, you will see how different allied healthcare professionals interact and help to manage Mrs. X's condition. And then subsequently, in station 8 and 9, you will see how the allied healthcare professionals in those settings help to manage her pain as well. Okay, so without further ado, let the journey begin. Amy, take it away.
So hello everyone, congrats on taking the first step as a healthcare professional. In this station, you will be the triage nurse at the polyclinic when Mrs. X makes her first contact with the healthcare system after her fall.
Good morning, ma'am. I'm Nurse Jing Heng, and I'll be attending to you for today.
Hello.
After introducing yourself, what would you ask Mrs. X? A. Can you read out your name and NRIC, please? B. What are you here for today? Or C. Do you need to go to the toilet? A poll has opened on the right and you have 20 seconds to answer. We will now be closing the poll, and A is the correct answer. At least 2 patient identifiers are required by healthcare professionals before administering treatment to patients. This is to verify that we are treating the right patients with the right orders. Identifiers can be the patient's full name, NRIC, or even their home address, as these are mostly unique to each individual.
My name is Mrs. XYZ and my NRIC is S1234567.
Thank you, Mrs. X. May I ask what are you here for today?
My ankle pain, it looks like swollen, I fell down 3 days ago and I thought the pain would go away, but it became worse. Now my leg's swollen until I cannot walk.
Oh my, that sounds terrible. If it's okay, can I assess the pain that you're feeling right now?
As the nurse, how would you assess Mrs. X's pain? A. Can you press on my arm to show me the pain you feel? B. Is the pain you feel very pain or not so pain? Or C. From a scale of 1 to 10, 1 being almost no pain and 10 being very unbearable pain, can you rate the pain you are feeling now? A poll has opened on the right and you have 20 seconds to answer. So we will now be closing the poll, and C is the correct answer. A pain score allows us to understand the extent of the pain felt by patients. Visual aids can help patients to visualize the degree of pain associated with each score as well. We can then administer the right treatment and determine if the patient's condition is improving. For example, if the patient's pain score has decreased from 7 to 3, the treatment plan for the patient is likely to be working.
Around 5 to 6, but sometimes when I take Panadol, then the pain will go away.
I see. That must be very painful, right? We'll see how we can help you to manage this pain. Now I'll be taking your vital signs.
So
Which equipment do you think is needed to take the patient's vital signs? You have 20 seconds to answer this poll as well. We will now be closing the poll, and the answer is D. We actually have to use all of the above to measure the 5 critical vital signs of the patient. The vital signs that we are referring to includes the patient's blood pressure, heart rate, respiration rate, temperature, and oxygen saturation levels. Any abnormal values in the vital signs can reveal information about the patient's overall health.
Oh, okay.
The vital signs of the patient have been taken and are all within the normal range.
Mrs. X, next, I'll ask you a few questions related to your personal life.
As the nurse, what kind of information would you like to gather? 20 seconds for this question. We will now be closing the poll, and the answer is A, medical and social history. Both the medical and social history are important, as some medical conditions may have implications on the treatment required. Social history also allows us to know what Mrs. X does on a daily basis to give us a clue on how the injury may have affected her life.
I have diabetes, but no drug allergies lah. I drive Grab one, but now because of this, I haven't drive for 3 days already. After I fell down, I thought this injury will heal, so I never come see doctor. Very expensive one, you know.
Oh, I understand where you're coming from now. But thank you for coming down to seek treatment, as we can help you recover and hopefully you'll be able to return to work as soon as possible. Now, I'll pass the information you have given me to the doctor. You can wait in the waiting room until your number is called. Thank you, Mrs. X.
Thank you, Agnes.
Congratulations! You have completed your first station as a triage nurse. With all of the information gathered, Mrs. X is ready to see the doctor for further diagnosis. The doctor has examined Mrs. X and has ordered an X-ray for diagnosis of the issue. You are now the diagnostic radiographer at the polyclinic seeing Mrs. X.
Hello, this is my number. What I do
Now, what do you think the diagnostic radiographer should do next? A. Ask Mrs. X what are her hobbies. B. Introduce yourself. Ask Mrs. X what she has come for and confirm the doctor's orders. Or C. Ask Mrs. X to position herself for X-ray as there are many other patients waiting. The poll has opened and you have 20 seconds to answer. We will now be closing the poll, and the correct answer is B. It is important for us to let the patient know what is happening and what they are coming in for. Confirmation of doctor's orders are also essential in preventing any medical errors.
Hi, I'm the radiographer and I'll be the one helping you take the X-ray today.
What? What radiographer? I don't know what is that leh. What does a radiographer do
So what do you think diagnostic radiographers do? A. Take pictures. B. Take scans that help doctors in diagnosing a problem. Or C. Talk to the patients. You have 20 seconds to answer the poll on the right. We will now be closing the poll, and the correct answer is option B. Diagnostic radiographers help doctors take X-rays, MRIs, and ultrasounds. I believe all of these are scans that you have heard of. Diagnostic radiographers also take other scans, such as nuclear medicine imaging, which records radiation emitting from within the body. Fluoroscopy shows a continuous X-ray image, where X-ray beam is passed through the body to make something that will look like an X-ray video. Interventional radiography, as the name suggests, is used in minimally invasive procedures to perform both diagnostic and therapeutic purposes.
Oh, wow, you all do so many things one ah.
Yeah, so do you know where do DRs actually work?
Wow, I don't know leh. Is it polyclinic ah?
So we do work in the polyclinic, but in many other departments too. You'll be able to find us anywhere that requires diagnostic imaging of the body.
Oh, so DR work in a lot of places lah. But DR sounds very boring eh. Every day only take pictures.
No, Mrs. X, there's a lot of soft skills involved in being a DR too.
So, what are some soft skills a diagnostic radiographer requires? A. To know how to pose for pictures. B. To communicate. Or C. To be physically strong so that you can turn patients to their positions. You have 20 seconds to answer the poll on the right. We will now be closing the poll, and the correct option is B, communication. As a radiographer, you meet people from all ages and backgrounds. Therefore, you have to develop good communication skills. Besides communication, you have to be alert. There are times where general practitioners or referring doctors like to order a whole lot of X-rays for a single patient, of which most of the times are unnecessary. As a diagnostic radiographer, you have to be alert and inform the doctor, as we do not want to expose the patient to too much unnecessary radiation.
Wow, being a DR is not easy ah.
Anyways, Mrs. X, I see that the doctor has ordered an X-ray for your ankle. May I know what has happened?
I fell down from the stairs not long ago. Then my right foot got some blue back and got cuts. Okay lah. At first not very pain, then I tahan. But then afterwards, wow, very, very pain eh. Then still become swollen eh. Then I very worried, so I come see doctor lor.
Okay, I see. It must have been worrying for you. Just to confirm, which ankle have you injured?
My right lor.
Okay, so I will be taking the X-ray of your ankle. Before we start, can I confirm with you your full name and NRIC?
Can. So my name is Mrs. X and my NRIC is 1234567A.
Proceed to take the X-ray then. Mrs. X, could you lie down straight for me?
Straight ah. Okay.
How do you think the diagnostic radiographer should ask the patient to position? A. Mrs. X, could you lie down flat on the X-ray table with both of your legs straight out, but put your right ankle flat on the black plastic film? B. Mrs. X, could you lie down and put the side of your ankle on the cassette? C. Mrs. X, could you lie down and position yourself? The poll has opened on the right, and you have 20 seconds to answer. We will now be closing the poll, and the correct answer is A. Option A gave the clearest and guides the patients in their positioning. Option B has medical jargons used, such as the cassette, and patients may not understand the instructions given. For option C, the instructions weren't clear enough to facilitate proper positioning.
Oh, okay, can I lie down properly lah?
Okay, Mrs. X, stay still and do not move for the X-rays being taken. Okay, the X-ray is taken.
Wow, so fast ah. Oh yeah, what is that round thing you wearing ah?
So what is the round thing that the diagnostic radiographer is wearing? A keychain, B, a name badge, or C, a radiation monitoring badge? The poll has opened on the right and you have 20 seconds to answer. We will now be closing the poll. And the correct answer is C, the radiation monitoring badge.
What is it for ah?
Because X-ray involves ionizing radiation, which may be harmful with long-term exposure, we radiographers wear this badge, which has a piece of radiographic film that is sensitive to X-rays or radiation. So each month, the film in these badges is processed to determine how much radiation each DR is actually exposed to.
Wow, this is interesting and also cute ah. It's nice talking to you radiographer.
It was nice talking to you too, Mrs. X. You may now proceed to wait outside room 25 for the review of X-ray with the doctor. Thank you.
Thank you, thank you.
So after taking the x-ray of her foot, Mrs. X could go back to her doctor to get the x-ray reviewed. Good job. We are now finished with station 2 and we'll be moving on. You are now a diagnostic radiographer at the hospital. After the x-ray at the previous station showed no fracture, the polyclinic doctor referred Mrs. X to an orthopedic doctor in Hospital A, and the orthopedic doctor ordered for an MRI from Mrs. X.
Hello, the doctor asked me come here. What do I need to do ah?
Hello, I am diagnostic radiographer Rainy. I'll be helping to take MRI for you. Can I check for your full name and NRIC, please?
My name is Mrs. XYZ and my NRIC is S1234567
Okay, did the doctor tell you what are you here for?
Yeah, he said I need to do a scan on my right ankle lor. Because I fell down, then it is very swollen and painful.
Okay, Mrs. X, yes, we are going to do an MRI so that we can see if you tore any part of your ankle because your x-ray showed no fracture. Now, can you please fill in this MRI Safety Questionnaire first?
So I just answer yes, no already can huh?
That's right, Mrs. X, and tick the bottom part as well if they apply to you. If you need any help, feel free to ask me.
Okay, can. Thank you ah.
Though simple, it is very important for patients to fill in this form before the MRI for their own personal safety.
Done liao.
Okay, Mrs. X, you can proceed to change into the gown prepared in the changing room while I prepare the relevant things for your MRI.
The patient has to change into a gown, but do you all know why? A, so the patient is safe and it ensures no blockage when taking the scan. B, it looks pretty and the gown is more cooling. Or C, the gown is cleaner than the patient's own clothes. A poll has opened on the right and you have 20 seconds to answer. We will now be closing the poll and the answer is A. Because the MRI can only scan accurately if there is nothing blocking it, the gown prevents any unwanted reactions between the machine and the patient's items. Now, what do you think can be brought into the MRI room? A, contact lenses, B, metallic items, or C, dentures? Again, the poll has opened and you have 20 seconds to answer. So we'll be closing the poll, and the answer is A, contact lenses. The MRI is like a big magnet, so all metallic items such as pacemaker or leg chains have to be safe for MRI. If not, they have to be removed, or another type of scan like CT scan has to be done instead. MRI scanners with lower strength can also be used if patients have non-removable but safe metallic items, though this may result in a lower quality scan. Contact lenses is safe for MRI.
Mrs. X, so you just have to remove your spectacles before you enter, since you stated no for almost all the questions in the form just now. Let me just double check to see if you have any metallic items on you.
Okay, Ken. Ayo, is it scary inside? I'm very scared of being in a closed space leh. The tube looks so dark and scary, oh my god.
Not to worry, Mrs. X. You don't have to put your head inside, just the bottom part of your body, because only your ankle is needed for the scan.
It is important to reassure patients and enable them to know the necessary information regarding the scan that they will be taking. After discussing the necessary information, Mrs. X and the diagnostic radiographer enter the MRI room. Now, what are some things that cannot be brought into the MRI scan? A, a headphone, B, earplugs, or C, a handphone. Again, a poll has been opened and you have 20 seconds to answer it. We will now be closing the poll, and the correct answer is C. Headphones and earplugs are required since it will be quite loud when the scan starts. Handphones, on the other hand, will only react with the machines, leading to unwanted consequences, and therefore must not be brought into the MRI room.
Okay, Mrs. X, here is the headphone and earplugs for you to wear because it will be quite loud.
If you can see, there is a casing around the MRI machine. Do you know what's the use of the casing for the MRI machine? A, aesthetic purposes. B, contains the magnetic fields required for the scan so that they won't affect other metallic items. Or C, prevents the patient from escaping. A poll has opened on the right, and you have 20 seconds to answer. We will now be closing the poll, and the correct answer is B. There are three kinds of magnetic fields for the MRI, namely static, radio frequency, and gradient magnetic fields, and these can affect the function of metallic items. The casing is there to prevent such issues. Besides the casing, the special copper MRI doors perform similar purposes as well.
Mrs. X, the MRI scan is done. You can leave the room now. After the results are out, I will upload into the system so that the doctor can see it and explain to you about your condition. For now, you can just change out of your gown and make an appointment to see the doctor a few days later for the results. Thank you.
Thank you lah, diagnostic radiographer. Your help really made me feel more at ease.
After the doctor saw the scan, they realized that Mrs. X had a partial ligament tear. Mrs. X would undergo a ligament reconstruction surgery as advised by the doctor. The doctor also noticed that the scratches Mrs. X got was not properly dressed yet. Hence, they sent Mrs. X to a wound nurse. But thanks to the diagnostic radiographer, Mrs. X finally found the cause of her swollen ankle from the MRI and can now receive proper targeted treatment. Good job. Now for this station, you'll be taking on the role of a nurse at a hospital. After the MRI scan, Mrs. X's doctor ordered the nurse to apply wound dressing to her injuries after realizing that the scratches were not properly dressed yet. As the nurse, what is the first thing you should do? A. Approach the patient. B. Check the electronic health record. Or C. Prepare equipment. The poll has opened on the right and you have 20 seconds to answer. So we will now be closing the poll, and the correct answer is B, checking the electronic health record. The electronic health record contains patient history, doctor's orders, and medical treatment plans. By understanding our patient, we are able to provide appropriate care for them.
Good morning, Mrs. X. I am student nurse Elizabeth, and today I'll be helping you with your wound dressing on your left ankle. Before that, may I know if you have any allergies to any dressing materials?
What is dressing materials?
Oh, Mrs. X, dressing materials are like cotton balls and gauze, etc.
Oh, no, Missy, don't have.
Okay, thank you, Mrs. X. So now I'll be preparing the equipment and I'll be back with you shortly. So here's the call bell in case you need any assistance.
So after leaving the patient, what's the first thing you should do? A, prepare the equipment, or B, perform hand hygiene. You have 20 seconds to answer the poll that opened on your right. We will now be closing the poll, and the answer is B, perform hand hygiene. After approaching a patient, hand hygiene must be done in order to minimize the risk of transmission of microorganisms between the healthcare worker, patient, and the environment. There are 5 moments of hand hygiene where healthcare workers need to observe. These are before touching the patient, before clean or aseptic procedure, after body fluid risk exposure, after touching a patient, and the patient's environment. Now we will start preparing the equipment. You have 2 dressing sets. Which dressing set would you choose? Hint, look closely. You have 20 seconds to answer. We will now be closing the poll, and the correct answer is A. As it expired, the dressing in A expires in 2025, while the dressing set B has already expired in 2020. When preparing our equipment like dressing sets, we have to check for DIE. This stands for discoloration, integrity, and expiry date.
Okay, now let's watch a short video on how to dress a wound.
Hi, my name is April. I'm going to be talking to you today. So I've already prepared my trolley. I've made sure I've cleaned it down prior to doing this task with Clinell wipes. I have some hand sanitizer and all my other equipment and my waste disposal here. One of the first things I'm going to do is I'm going to raise this bed to a good working height for myself to protect my back. Very good. And I have a bluey here, so I'm just going to pop under the patient near the wound area to catch any exudates or dripping that occurs while I clean the wound. Going to grab my dressing pack, making sure it's in date as well. Get that all set up. So my first fold out is going to be away from myself. For this particular type of dressing pack, the second one will be towards myself, then to the right and to the left, following the tabs. Now tip it out carefully. Grabbing my cleaning solution, Again, taking care not to lean over my field too much more than necessary, and put my solution in the little tray there. I'm going to do it from a good height, approximately 10 centimetres, not so high that it splashes everywhere, but not so low either that I break my sterile field. I'm also going to get my dressing and pop it in the tray there. Whatever's going to be most appropriate for your wound at the time. For today, we're going to use this product. Okay. Going to do some more hand hygiene. Making sure, of course, before I've started this task, I make sure that I'm bare below the elbows, no watches or rings, and that I've done a procedural hand wash as well. I'm going to carefully pick up one pair of my tongs without touching anything else, and then use that first pair to pass my second pair of forceps to my other hand. Then I can freely place things where they need to be, popping my cotton balls in the solution. I've got my drying gauze, and a sterile towel is there for use. Making sure your cotton balls are nice and wet with the solution, not drying them out too much, because the wetness is what's going to actually help get the solution into the wound and give it a really good clean. So I want to clean it nice and fairly firmly so that we're actually getting all of the debris and other matter off. And this is why analgesia beforehand is really important. Notice too that I'm working in a circular motion for this type of wound, cleaning from the inside out, and making sure that I clean the peri-wound as well as the wound bed itself. Always be careful too when you pop your waste in the bin that you don't accidentally contaminate yourself by touching the trash bag. Now I'm going to dab my wound dry. Because I'm finished with my tongs for the moment, I'm just going to pop them to one side on the edge of my sterile field, handles facing out. With my dressing that I've already grabbed out, they are designed so that the inside can remain sterile while you apply the dressing. So I'm going to very carefully take the backing away without touching the inside. This part might be slightly trickier depending on where you're dressing, and apply.
So now we'll be asking some questions based on the video you just watched. When opening the dressing set, which fold should you open first? A, the fold towards you, or B, the fold away from you? You have 20 seconds to answer the poll. We'll now be closing the poll, and the correct answer is B, the fold away from you. According to the principle of surgical asepsis, all sterile packages should be opened away from one's body, and one's hand should not extend over a sterile field. Now the second question is, how should you clean a round wound? A, from the inside to outside, or B, from the outside to inside? You have 20 seconds to answer this poll. We'll be closing the poll now, and the correct answer is A. Clean the round wound from inside to outside. We clean round wounds from the inside to outside so that they are clean from the least to most contaminated. This is to avoid introducing more pathogens to the wound.
Okay, thank you, Mrs. X. So we are finished with your wound dressing. So may I know if you need anything else?
Thank you so much, Missy. May I know how much this will be?
It will be about $30.
Wow, so expensive. I'm the only person working in my family, but now I'm hospitalized, so I can't work. I don't know how I will pay for the hospital bills.
Oh, okay, I see, Mrs. X. So from what I'm hearing, you are feeling quite stressed because of your financial problems, right?
Yes, I'm very stressed.
Oh, okay, Mrs. X, is it okay if I actually refer you to one of the hospital's medical social workers? She'll be able to further advise you and give you more support.
Okay, thank you so much, Missy.
Okay, you're welcome.
Thank you to everyone for helping Mrs. X with her wound dressing on her ankle. Her wound is now clean and free from infection. Wonderful job. Now, welcome to the medical social worker station. Mrs. X was referred to you as she was having some financial difficulties.
Hi, Mrs. X. I'm Alicia and I am the medical social worker who will be helping you today. Before we begin, may I check with you your full name and your NRIC?
Hi, Alicia. My full name is XYZ and my NRIC is S1234567A.
Okay, thank you so much, Mrs. X. Can you share with me more about what brings you here today?
Actually, I told the doctor I got no money to pay him. Then he asked me come see you. Is it you help me pay?
Mrs. X, I cannot help you pay, but what I can do for you is to look through some schemes together with you to provide you with the necessary financial assistance. So, could you tell me more about yourself?
Actually, I do grad 1. But then because of COVID, I kena fired, then cannot find job. It's been very hard lah. Because my family only got me earning money. Now I feel very stressed and sad. Like I disappoint my family, you know. Somehow everybody also like not very happy, make me feel even more sad.
Mrs. X has just shared her concerns with you. As a medical social worker, what's the best course of action you can take to support Mrs. X? A. Refer her case to a family service center in the community. B. Apply for financial assistance for Mrs. X. Or C. Finding out more about Mrs. X's family background and financial situation. You have 20 seconds to answer the poll that has opened on the right. We will now be closing the poll, and the correct answer is C. Medical social workers aim to find out more about the patient so that we can find the best possible way to support them. Mrs. X's financial problem seems to be troubling her the most. However, it might not be the only concern present. A case management approach would allow us to understand her situation better and then address her situation completely.
So we'll move forward with option C.
Thank you so much. Actually, other than my hospital fee, I'm quite worried about my day-to-day expenses. My children so young, I don't know when can discharge, got no job. Then my food like this, confirm cannot drive Grab already. If I don't drive, got what other jobs for me? Every day I think of this thing, like this type of thing. Then I cannot sleep, you know.
As a medical social worker, what can you then offer to support Mrs. X? A. Speak with a physiotherapist or occupational therapist to find out about her rehabilitation potential. B. Refer her to the social service office. Or C. Refer her for job coaching or career matching support. You have 20 seconds to answer the poll on the right. We'll now be closing the poll, and the correct answer is B. The medical social workers follow up with members of the healthcare team to understand more about the level of care needed for the patient. This knowledge allows medical social workers to understand how much support patients require while in hospital and allows them to arrange for any necessary support upon discharge. While for option A, this can only apply for after her discharge. For option B, this can only apply to after her discharge, as medical social workers can only provide psychosocial support while warded.
So we will move forward with option A, which is to speak with the therapist to find out about her rehabilitation potential.
Wow, thank you, thank you. I think while I'm recovering, there will be some times where I won't feel so good about myself. Is there anything you can do to help me with that?
So what are some immediate courses of actions you can take to support Mrs. X's mental health concerns? A. Refer her to a family service center after discharge. B. Offer psychosocial support and refer her to community agencies for counseling. Or C. Speak to her husband and her family. You have 20 seconds to answer the following poll. So we will now be closing the poll, and the correct answer is B. Offering psychosocial support, exploring concerns, and validating the patient's feelings are beneficial for them. Referral to community agencies post-discharge can also offer similar support.
Wow, I feel a lot better now. Thank you for listening to me and helping me with my problems.
Through this conversation with Mrs. X, we have been able to understand her financial and emotional concerns. With this knowledge, we as medical social workers can help to advocate for the patient and communicate with the other healthcare professionals involved, such that they are better able to understand Mrs. X's situation.
So thanks to the medical social worker, Mrs. X feels a lot better. Now we have come to the pharmacy station. After seeing the medical social worker, the pharmacist came to do a prescription check with Mrs. X prior to her discharge.
Hi, Mrs. X. I am Nicole, a pharmacist here to give you your medication before you go home. Can I confirm what is your full name, NRIC, and if you have any drug allergies?
My name is Mrs. XYZ and my NRIC is S1234567A. I have no drug allergies.
Okay. May I ask what was the problem or illness that you were being treated for in the hospital?
I have diabetes and I am here because of my wound on my ankle. Sorry, can you please hurry? My children is waiting for me. I don't want to hold them up.
Okay, Mrs. X, I will try my best to give you your medications as soon as possible. We just wish to check to ensure that these medications are safe and effective for you to use at home. May I ask, do you know what medications you have been taking the past few days in the hospital?
I told the other doctor already. Need to ask again.
Yes, Mrs. X, I just wish to double confirm that what you are currently taking is in the hospital, tallies with the record, and to see how familiar you are with these medications.
Oh, so I've been taking 4 medications. First one, of course, is my diabetes drugs, metformin lah. The one that I take when I eat breakfast and dinner. Then the second one is the antibiotic. I forgot what name now. Then the third one is the ibuprofen for my pain and swelling ankle. And the last one is also omeprazole for the pain lah.
At this point, you realize that Mrs. X might have a misunderstanding about one of her medications. What should you do? A. Ignore the patient's mistake. As long as she takes her medication, it's okay. B. Correct her. Let her know what is the correct purpose of taking the drug. You have 20 seconds to answer the poll on the right. We will now be closing the poll, and the correct answer is B. It is important for the patients to know the correct indication for the drug to reduce non-adherence caused by misconception. If she knows what the drug is for, she can better manage her condition and adhere to the medication as ordered.
Yes, Mrs. X, you got all 4 drugs correct. However, I would just like to bring to your attention the drug omeprazole. It is actually not for your pain. It is to protect your stomach. Taking ibuprofen increases your risk of stomach ulcer, and omeprazole helps to protect your stomach lining. So as long as you are taking the ibuprofen, it is important that you take the omeprazole too.
Oh, I did not know omeprazole was to protect my stomach. Wow, thank God you told me. If not, I go home then no pain. I won't take the omeprazole. The consequences would have been disastrous.
So what are some important drug information you would like to give Mrs. X? A. Side effects. B. Threats to overdosing. C. Strength of drug and dosage. D. Special instructions such as not to take other drugs or herbal products, how to take with food, or how not to stop abruptly. E. Importance of medication compliance. Or F. Food to go with medications. There are more than one right answer. You have 20 seconds to answer this poll. We will now be closing the poll. All of these are important things to tell Mrs. X, but things such as side effects, strength of drug and dosage, special instructions, and importance of medication compliance are especially essential.
Can I just ask, can I not take the antibiotic medication? You see how my leg already no more yellowish thing come out了. Then I also no fever and whatsoever. I don't think I need to take the antibiotics. Can save money also.
As the pharmacist, how would you respond? A. I will talk to the doctor to see if the antibiotics can be stopped. B. Maybe I will go and double check the orders again. There might be a mistake. C. No, you have to complete the antibiotic course to ensure that you've killed off all the bacteria that previously caused your infection. D. Sure, your comfort and preference matters most to us. Since you do not have any symptoms, it's okay for you to stop taking. You have 20 seconds to answer this poll. We will now be closing the poll, and the correct answer is C. Antibiotics should not be stopped abruptly and must be completed according to the well-studied protocols, even if the patient is feeling better.
Are you very sure, pharmacist? I really no money already, and my children need their pocket money. Anyway, I no more fever already, and the yellow thing no more already. I don't need to eat the antibiotics also. Should be okay one. Last time I do that, nothing happened to me also.
As you can see, giving only the answer sometimes might not be enough to calm the patient down. It is always advisable to acknowledge the patient's feelings to display understanding before answering the patient's question.
It's great news to hear that your fever has subsided and there is no more pus from your wound, Mrs. X. However, there is a possibility of surviving bacteria against antibiotic resistance, and hence it will be much tougher to treat, and we will have to start you on stronger antibiotics in the future.
Oh, I understand already. So you're saying if I don't finish the antibiotics, in the future it will be harder to treat because the antibiotics that was used to work will not work anymore, right?
That's right.
Wow, so serious ah. Okay, I better take the antibiotics ah.
After watching the pharmacist interact with Mrs. X, what do you think are some good qualities a pharmacist should possess? A. Persuasive and gentle, no matter what it takes, even white lies. B. Patient, detail-oriented, and empathetic and encouraging. or C, sharp and critical above all? You have 20 seconds to answer the question. We will now be closing the poll, and the correct answer is B, patient, detail-oriented, empathetic, and encouraging. Now, Mrs. X understands the medication she has to continue taking following her discharge. Her doubts were clarified, and she's confident in managing her own medication taking. Good job. Now, after the doctor's diagnosis, Mrs. X underwent a ligament reconstruction surgery for her affected ankle. She now begins to see a physiotherapist at the hospital to begin her rehabilitation journey.
Hello, Mrs. X. I'm your physiotherapist for today. What can I do for you today?
Hello, physiotherapist. Could you help me do something about my ankle? I really hope that the pain in my ankle will lessen, and I also want to be able to walk independently ASAP.
From the conversation with Mrs. X, the following information could be obtained. 1. She had an ankle ligament surgery 2 days ago. 2. She has pain in her affected ankle. And 3. She hopes to be able to walk independently.
Based on this information, should massage or strengthening exercises be first prescribed to Mrs. X? You have 20 seconds to answer the next poll. We will now be closing the poll, and the correct answer is B, strengthening exercises. Physiotherapists typically use exercise as the first and fundamental form of treatment. Treatments such as massages are considered adjunct, which can be a component of the rehabilitation process but should not be the main mode of treatment.
That's great. I was informed by the doctor that I should not be placing any weight on my affected ankle. Is it possible to move around after surgery?
Mobility aids, such as crutches and walking sticks, would help to transfer the body weight away from Mrs. X's injured ankle, allowing her to move about post-surgery.
So which is the most appropriate form of mobility aid? A, a walking stick, B, auxiliary crutches, or C, a wheelchair? You have 20 seconds to answer the poll. We will now be closing the poll, and the correct answer is B, auxiliary crutches. These mobility aids help to transfer the weight away from the injured ankle while allowing the patient to move about more independently. Auxiliary crutches offer the greatest space of support to stabilize Mrs. X. In addition to the mobility aids, Mrs. X would also need some exercises to strengthen her muscle. Which of the following exercise would you prescribe to her? A, straight leg raises, B, push-ups, or C, jumping jacks? You have 20 seconds to answer the question. We will now be closing the poll, and the correct answer is C, straight leg raises. Straight leg raises will help to strengthen Mrs. X's leg muscles without aggravating her ankle injury. Physiotherapists prescribe exercises to strengthen the muscles in patients while ensuring that the injury does not worsen.
Okay, this will help me strengthen my leg muscles but not aggravate my injury. Thank you so much, physiotherapist.
With the crutches and exercises prescribed to Mrs. X, her condition gradually improved and she was able to move about more independently. Good job.
You are now a community nurse seeing Mrs. X at her home. After Mrs. X was discharged, she was referred to a community nurse. In the referral letter, the doctor mentioned that her sugar level has been high and that the patient has been defaulting on her medical appointment. The doctor also requested that the community nurse help to assess and dress her wound to prevent further infection.
Hello, Mrs. X. I'm the community nurse, Jaslyn, that is assigned to your case. How have you been?
Like that, lor. So many things going on. It's so stressful.
Oh dear, it must be a tough time for you. Is there anything I can help you with?
Oh, thank you so much. So many people tell me so many things. I'm so confused about so many medications, appointments, and I am afraid that the wound will not heal properly.
No worries, Mrs. X. Let's work things out together.
Thank you so much.
I understand there's many things going on. We can look at it one by one and find a solution that you are comfortable with.
Sounds great. Thank you.
No problem. Okay, there's a couple of things that we want to do today. So firstly, I want to understand about your situation. I understand that you have been defaulting your appointment and recently you got injured and needed help in your wound.
Yes. They asked me to check my wound and do some cleaning, but I'm so scared to see my wound.
No worries. Which one will you want me to assist you with first?
First, maybe about the medical appointment first?
Mrs. X has chosen the first option, which was to address why she did not attend her appointments regularly.
So how was your visit with the doctor so far? Did the doctor speak to you about your condition?
I find it hard to communicate with my doctor. I can only understand Chinese, but my doctor keeps speaking to me in English. It is also too troublesome and far to go to the hospital for a visit.
As a community nurse, what can you do to make things easier for Mrs. X? A. See if family members can follow her, or B. Refer to the nearest polyclinic for a follow-up. You have 20 seconds to answer. The poll that is open on the right. So for this question, there is no correct answer. There is no perfect solution, but we need to find one that the patient is comfortable with. For the first option, to see if any family member can follow her, the family members can be an advocate for the patient and can ensure that the patient understands the procedure and keep track of doctor's instructions. We should always ask the patient if she is comfortable with the situation. Otherwise, if you chose option B, refer to nearest polyclinic. Since distance is something that is hindering Mrs. X, referring her to a nearest polyclinic can help to resolve the problem. But again, it's always important for us to ask the patient if she is comfortable with this arrangement.
Mrs. X, are you okay with this solution?
Yes, this sounds like a better plan.
Now that we have identified a solution for her not attending her appointments regularly, the nurse will now proceed to discuss about wound care with Mrs. X.
Mrs. X, before I end the session, may I assess your wound to see if there's any signs of infection, and after that I will clean your wound.
Thank you, nurse. It's been 2 days since I last opened my wound to check. I'm too scared to see any blood.
Oh, I see. No worries, Mrs. X. I will assess your wound and then I'll clean now. It may hurt a bit, so let me know if you face any discomfort.
Okay.
Okay, I'm cleaning now. Is there any pain so far?
No, thank you.
Okay, actually, Mrs. X, I cleaned the whole thing already. The wound seems quite okay. It's healing quite well. But do remember to keep the wound dry and intact. And when you shower, you can cover it with a plastic bag to avoid getting wet.
Okay, I will take note.
I will actually visit you 2 days later to recheck the wound and help you to clean. Is there anything that I can help you with?
Don't have. Okay, thank you. I want to return back to work as soon as possible. However, I cannot remember the exercises.
Okay, not to worry, Mrs. X. Is it okay I refer you to my fellow colleagues, the PT and OT? They will come and guide you and teach you about the exercise again.
Yes, that would be great. Thank you.
Thank you for helping Mrs. X. As community nurses, we're here to step into their boat, understand patients' needs, and help them with everything through collaborating with other allied health professionals. So after talking to the community nurse, Mrs. X started attending all her appointments regularly, and her wound has also gradually improved. Good job. So Mrs. X has regained full weight bearing status and basic mobility. Upon referral from the community nurse, she is now visiting a physiotherapist and occupational therapist at the community hospital. Mrs. X first enters the room to visit the physiotherapist. Upon entering the room, she sees the physiotherapist seated in the room. What do you think the physiotherapist's posture should be like? You have 20 seconds to answer the poll on the right. We will now be closing the poll, and the correct answer is C. Regardless of your healthcare profession, it is important to carry yourself well. Leaving a good first impression is key to building trust with your patient. Small details like our body and sitting posture matters. Sitting upright in an open posture is a display of your willingness to listen to what the patient has to share. Option A portrays a slouching posture, which may be perceived as disinterested. Having your arms crossed like option B may be perceived as a sign of authority. Now that the patient and the physiotherapist have met, how should the physiotherapist first address and communicate with the patient? A. Hi Mrs. X, how are you feeling today? Can you tell me more about your foot? B. Hi Mrs. X, what's wrong with you today? Why are you here? C. Hi Mrs. X, the hospital says you have a slight ankle instability. Today I'll be working on this with you. You have 20 seconds to answer the following poll. We will now be closing the poll, and the correct answer is A. Option A entails an open-ended question, which will allow Mrs. X to openly share about her recovery progress. This allows the physiotherapist to get a better overview of the patient's condition. Option B may sound too hostile or patronizing for some patients, and could cause the patient to be more distant and less willing to share. Option C portrays the physiotherapist as an authority figure who does not discuss the treatment plan with the patient. It's important that when designing treatment plans, that it should be a collaborative effort by both parties. Involving the patient is key to ensuring compliance and commitment to the treatment.
Hi, Mrs. X. How are you feeling today? Can you tell me more about your foot?
Hello, PT. I'm fine. My foot is getting better after following the exercises that the hospital PT taught me. I can move it more and walk better now. I think I'm ready to return to work.
I see, that's great. Let me perform a physical examination to see how well you've improved.
The physiotherapist will perform various physical examinations to test for the patient's ankle strength, mobility, balance, and range of motion.
Wow, it seems you have been recovering well. I understand that your goal is to recover quickly and return back to driving. Based on my examination, I see that you're still facing some ankle instability and have trouble accomplishing full range of motion. Accomplishing common walking patterns and maintaining balance is also a bit of an issue for you. So we will be working together to come up with a plan.
Upon completing several weeks of therapy in the community hospital, Mrs. X is now more or less able to return to work. The physiotherapist refers her to the occupational therapist to assess her ability to return to driving.
OT, I want to return to work as soon as possible. And my family's sole breadwinner. The PT said my leg is a lot better now, but I still need to see you before I can return to work. Can you help me to check?
Hi, Mrs. X, definitely. I'm happy to see that you are able to walk independently now. So my job is to design activities for you to achieve specific day-to-day movements and assess your readiness to return back to work. Can I see your ankle?
There?
So Mrs. X wants to return to work. As a Grab driver, which of the following movements should be assessed? A. Scenario-based activities, such as emergency braking. B. Ankle range of movement. Or C. Squat strength. The poll is open on the right and you have 20 seconds to answer. We will now be closing the poll and the correct answer is A. Occupational therapists focus on facilitating patients back to their specific occupation, assessing her competency to perform what her occupation requires, such as emergency braking, rather than her strength or range of motion is of greater importance.
Great, seems like you're recovering well. I will be helping you to apply for Driving Assessment and Rehabilitation Service, known as DAS, where I will join you for an on-road driving assessment to determine your readiness. Here's a DAS brochure for you. Thank you.
Congrats, guys. So now we have come to the last station. So for a quick recap of the station so far, you guys first follow a nurse at the triage in the polyclinic, diagnostic radiographer at polyclinic, then in the hospital, followed through nursing wound dressing, medical social worker, pharmacist, physiotherapists at hospital, nursing at community, and lastly, physiotherapist or occupational therapy at community. So as you can see, in order to provide patients with the best care possible, there needs to be a coordinated effort between members of the multidisciplinary team. What you guys have just experienced is merely a glimpse of how it will be like. The other allied health professionals, which Jonathan shared earlier, they are not covered in this journey, also played a part in making a difference in the patient's life. For more information about the respective disciplines, there's an e-brochure which can be downloaded from the exhibitor booth under files. Alternatively, you may also check it out under the Healthcare Scholarship website at www.healthcarescholarships.sg/healthcare-disciplines. Now let's have a mini poll quiz to accumulate participation points. Please use the poll function to answer, and as the questions are really very easy, we will test you on your speed. So you have 10 seconds for each question. So the first question is, are we allowed to gather personal history such as medical history, social history, etc. from a patient during triage? So the poll is now open. You may key in your answer. Okay, so the poll is now closed and the correct answer is actually A. So as a nurse in the triage, you are actually able to get relevant history that is relevant for you to better understand the patient's condition. Now, the second question is, why do we need to get the history of a patient's current complaint when taking an X-ray? Is it A, to get the correct positioning, or is it B, for fun? You have 10 seconds to answer the questions using the poll function. Okay, so the poll is now closed and the answer is obviously A, to get the correct positioning. So now we will move on to the third question. So which of the following is one of the job scope of a diagnostic radiographer? Is it A or is it B? Remember to read carefully because both the answers are actually quite similar. Okay, so the correct answer is actually A. So the only difference between A and B is that B has a teaching strengthening exercises, which is actually not what the diagnostic radiographer does. Now we will move on to question 4. So what do you need to check for the dressing set before performing the procedure? Is it A, discoloration integrity or expiry date? Or is it B, disintegration, indications and expiry date? Okay, so the correct answer is actually A, which is discoloration, integrity, and expiry date. Okay, now we'll move on to the next question. So what kind of technique should the nurse adopt when cleaning the wound for a patient? Is it A, inside to outside, B, right to left, or is there no special technique? Okay, so actually the correct answer is A, is actually inside to outside, which actually just now the station 4 has shared with you guys through the video. Now we'll move on to the next question. So what are some situations that the medical social worker is able to provide help in? Is it A, unemployment, financial difficulties, or emotional concerns? Or is it B, unemployment, financial difficulties, or breaking up with a partner? Okay, so the correct answer is actually A, which is unemployment, financial difficulties, and emotional concerns. So now we'll move on to the next question. So what does the pharmacist needs to educate patients on their medications? Is it A, to allow patients to better manage their condition? Or is it B, to allow patients to prescribe their medications to others? Okay, so I can see that many of you actually got this question correct, which is A, to allow patients to better manage their condition. So now we move on to the next question. So what is a common treatment that physiotherapists usually adopt? Is it A, strengthening exercises, or is it B, massage? Okay, so the correct answer is actually A, strengthening exercises. So the physiotherapists that you will adopt the strengthening exercises as a form of treatment for their patients. So now we move on to the second last question. So as a community nurse, how can we help a patient who refuses to take his medications regularly? A, is it to get the family members to help, or is it do we just leave the patient alone? Okay, so many of you, actually 100% of you got this question correct, which is A, get the family members to help. Now we'll move on to the last question, which is a really tricky one, which is what is the job scope for occupational therapies? Is it A, to facilitate independent learning, or is it B, regaining strength and mobility using various therapy techniques? You have 10 seconds to answer this question. Okay, so actually I see that most of you is a 50-50 for this question. So actually the correct answer is A, is to facilitate independent learning. The answer choice B is actually a physiotherapist job scope. Okay, so we hope that you guys had fun in this mini quiz, and with the interest of our patients in mind as healthcare professionals, there is always a need for discharge planning to enable our patients to return back to their daily lives, such as to work, to participate in sports, or to do things that they enjoy. From an acute to rehabilitative, then community setting. So this integrated chain of care aims to be cohesive for an acute to rehabilitative care community setting, drawing parallels to the 3 Beyonds directive by the Ministry of Health, which are beyond healthcare to health, beyond hospital to community, beyond quality to value. For quality healthcare in Singapore. As this Working with the Healthcare Professionals session comes to an end, we hope that you guys have a better understanding of what healthcare professionals do. We not only journey with our patients through their highs and lows, but are also privileged and equipped in a position to touch their lives, to acknowledge their worries, and to empower them towards their individual goals, celebrating milestones along the way. So now we will now be passing the time to Jia Ying for the Q&A session.
Hi, thank you, Elaine, and thank you to all speakers who shared about the various case studies and what healthcare professionals do encounter in their day-to-day lives. I'm sure many of you guys now have burning questions to ask our fellow healthcare students. So now we'll proceed on to the Q&A session. I'm Jia Ying, a Year 3 pharmacy student from the National University of Singapore, and I'm the moderator for this Q&A session. Today, we have with us here representatives from MOHH and various healthcare disciplines. From MOHH, we have Ms. Serene, who is one of our scholarship officers. From Occupational Therapy, we have Eng Yi. From Physiotherapy, we have Jonathan. From Nursing, we have Elaine and Elizabeth. And from Pharmacy, we have Joey and myself here to answer related questions. All right, I will also share with you guys how to utilize the Q&A function. So if you look to your right, you will see 3 tabs, which are the chats, Q&A, and polls. For us to see your questions, do make sure you type your question into the Q&A tab. Also, just a tip, if you'd like to see a question that you would like for it to be answered, make sure you click the little arrow below the question to upvote the question, and make sure the questions you have will be answered. All right, seems that we have a lot of questions on the floor. So maybe we will just pick the one that has the most votes now. So the question is asking, what are the qualities that you are looking for in potential candidates? So our speakers, would you all like to answer?
Scholars, you guys can go first, and then I will come in from a scholarship officer perspective.
I think like for potential candidates, I think what they're really looking for is your passion. I'm pretty sure that most of us here, we really have passion for the healthcare setting, and we are really have a vision of what we want to be serving the patients. So I think one of the major qualities is really your passion and what you want to do and how you want to contribute to the healthcare community.
Anyone else wants to take this question? If not, I can answer. Okay, so I'm a scholarship officer and I do sit in interview boards. I think if I'm not wrong, I think I've interviewed some of them here. So, so just what qualities do we look out for? I think when you come into the interview room and we are there, it's a panel interview. So a panel interview of about 4 people. And we are there actually really just to get to know you better, to know what you have done in your school, your CCA, what leadership qualities you have, and why you actually want to take up this scholarship and also this discipline. So I would say qualities, there isn't a specific like checklist that we have like, oh, this person needs to be this, and that. But it's really when you come in and the answers that you give us to the interviewers actually really matters to see whether you really, like what Elaine said, whether you have the passion for this discipline or not. So it can really be seen through the way that you answer the questions, like whether have you gotten more research, have you talked to any healthcare professionals, things like this. And one of the things that we do look out for is communication, because I think in my earlier presentation for eligibility, I mentioned to have good communication skills. So all healthcare professionals needs to have very good communication skills, because you're communicating with not only your patients, your patient families, and also the rest of the healthcare professionals, like what you have seen in today's segment. So you really need to know how to communicate your action plan, communicate your what has your patient gone through. So good communication skills is really one of the things that we do look out for in this interview. Yeah, I have nothing else to add for this question.
Thank you, Serene and Elaine. So if other speakers don't have anything else to add, maybe I'll move on to the second question. So the question is asking, do you have to get perfect A's for A-levels or GPA 4.0 for poly? So what if my result is BBB? Well, perhaps maybe I'll just speak from personal experience. I would say the short answer is no, you don't have to get a perfect A or a full GPA for poly. But definitely that will depend on the individual courses that you will be going to. So for instance, I believe that different courses will have different course requirement, and it actually depends and differs different year by year. So perhaps you will have to check the current school's intake and what is their cutoff points and GPAs for the course that you will be interested in. Yeah. Yes, but for the scholarship application, then anyone else want to take the question? Do you have to have perfect results for A-levels or poly?
Maybe I can post back the question, did y'all get perfect results for your some of your O-levels, some of your A-levels and polys? So maybe I can post this question to y'all. Did y'all get straight A's or do you get 4.0? No, I see a lot of shaking of your heads. So I guess that's a very good indication that our scholarship actually is not the criteria for you to get straight A's, because we do know that it's not you as a person is not just being defined by grades alone, but we do look at your application holistically. Yeah, so we look at your CCA records, your write-up about yourself also lah. So why you chose this discipline and how do you come to this realization that you want to pursue this path?
Yeah. So thank you, Serene, for answering this question also. So yeah, like as what Serene said, I feel that the most important thing that you have to consider first is your passion, and then for the grades wise, it also depends based on the different institution, and many of us actually don't really have perfect grades as well. Yeah. So hope that you can join the healthcare family. Yeah. So the third question we have here is the session that we have here today similar to the ones that we will face during multiple mini interviews? And another question that is closely related is, will we need to role play during the interview as if we are attending to the patient? So actually we have answered one of the question, which is that MOHH does not conduct multiple mini interviews. However, the MMRs are only applicable to SIT. So perhaps maybe we do have some SIT scholars here. Maybe they can help you to answer some questions relating to what will happen during the MMRs and the details.
Maybe I can answer that question. I think along the years, because I'm currently a year 4 student in SIT, so I think along the years they actually changed a bit of the interviewing format. But then back then when I did, I think there are a few stations. So one station is the professor would actually ask you about the current affairs in the healthcare industry to get to know your perspective and some of the insights you have, and to also understand to see if you know what is the healthcare landscape in Singapore as well. And then the other station is about giving you a scenario and then seeing how you respond to the situation. So it could be a patient, reacting, in a negative manner, and how you respond to that. And then I think the third station is related to, I think, just a very generic station, just to know more about you. Yeah, but I think this was done about 4 or 5 years ago. Yeah, because I actually went for the interview when I was in army, so that was almost 4 or 5 years ago. So perhaps someone who is in SIT but is maybe year 1, year 2, you might have the more updated version lah. Yeah, but generally they like to know that whether you as a person, you have the passion for healthcare, for like physiotherapy, for example, and also how are you like as a person, whether can you communicate, can you sustain a communication, a conversation with someone else. Correct.
Hi, I'm Ying Yi. I'm studying occupational therapy. I don't study at SIT, but I did go for the MMI SIT. So it is very similar to what Jonathan said, but I think it was 4 stations. So one is like a generic interview to find out like why you're interested in your course and just understanding more about you. One is a group discussion. So you'll be given a topic related to healthcare and you just discuss it. What are the pros, what are the cons, things like that. And then the other 2 are sort of like what we did today. So yeah, role playing a character. To my memory, it wasn't specific to healthcare. So mine was like about volunteering. So it was set in a volunteering context, but how would you respond to a situation like this? Yeah, so that's my memory of how MMIs were. And yeah, even when I'm not sure about the others, but for me, even once I started my uni, a lot of my assessments are sort of like this. So you're role playing the patient, you're role playing the healthcare professional, and then your assessment is based on how you respond. So yeah, today was actually quite a good sort of idea of how it will look like. Thank you.
Yeah, thank you, Amy and Jonathan. Any other scholars would like to add into the question regarding MMI? If not, then we'll move on to the next question in the interest of time. So what is the difference between OT and PT?
Okay, I will take that question. A very common question. Yes, I understand. What my professors love to say is that just because you can run and you can hold a baseball bat doesn't mean you know how to play baseball. So that's the thing that they always tell us. So for physiotherapists, they do focus a lot on like your body, so like your strength, whether you can run, whether you can walk, and like holding a baseball bat, so your balance, your coordinations. These are things that they focus on. And then for occupational therapists, we focus on occupations. And occupations don't just mean like your job, like your formal job. Occupations can refer to like just activities. So for Mrs. X, it was driving, which was just nice her occupation, but it could refer to like doing the laundry, going out to do your own grocery shopping. These are essential tasks that you need to do on a daily basis. There's confusion between OT and PT because there are overlaps, I understand, such as like in driving, you need to be able to sit yourself upright to be able to drive. And that's like something physios will have to work on, like your muscles and your balance, things like that. So there is overlap, and that's why OTs and PTs, we do work very closely together and collaborate. But the main difference is just our objective for the patient. So physios is a lot on the body and OT is a lot on the activity or the task itself. Yeah. Hope that clarifies things.
Does the PT scholars have anything to add?
No, I agree with Amy. I think she broke it down very clearly lah. Correct.
Yeah, so I hope that he has cleared the misunderstanding between OT and PT. So moving on to the next question. So as a nurse, so this question is probably targeted towards our nursing scholars. So as a nurse, do you have to shower, clean up patients often? How often do you come into contact with feces, vomit, etc. often? So probably this question will be asking about some challenges. What challenges do nursing students face, and how do you feel about it?
Okay, I think I'll take the question. So hi, I'm Elizabeth. And as nurses, we actually learn the showering and cleaning techniques for our patients because some patients may be
Sorry, I think Elizabeth is experiencing some technical difficulties. Eileen, would you like to proceed first?
Yeah, sure. Okay, so like what Elizabeth was sharing halfway. So yes, actually, as nurses, we need to, it's really the basic fundamental to learn how to take care of our patients' hygiene, like showering them or cleaning the vomit every day. But there's actually so much more to just those, because those are really just very basic. So like as you can see just now in station 4, there's actually even wound dressing care. So there's really so much more to just like showering and cleaning up. Like the patient's hygiene is the basics, but then there's so much more, like for example, ensuring that the patient's medications are taken on time, and then ensuring that the patients are emotionally okay, or even ensuring they are okay for any like surgery procedures and so much more. So actually showering and cleaning up, I think this is a misconception. Like a lot of people think that nurses will just shower and clean them up and really changing their diapers, all this, but there's really so much more responsibility as a nurse apart from just those. So I can share a bit, like I actually had a nursing home attachment, and yes, we really do, because they're all elderly, so we do a lot of showering and cleaning them up, but then we also manage to interact with them, and then make them, and they're really, these elderly are really very happy to see us, and we also get to feed them and really just taking care of them like our akong and amas like that.
Thank you, Elaine. So I think Elizabeth still facing some network difficulties. So it's okay, we will have her to help us to answer the question afterwards. The next question we have is, what if some healthcare professions are becoming outdated? Like, for example, pharmacy, because now we have robots to dispense medications.
Okay, so I'll take that question. My name is Joey, and I'm a pharmacy student, year 3 from NUS. So I think this question is quite valid. Like a lot of people have this idea that, now we have robots to do a lot of things. We have robots to, okay, but first I need to clarify the question. So the question said, pharmacy may get outdated because we have robots to dispense medications. But actually, in fact, dispensing now, we still do see pharmacists in the hospital settings and community settings dispensing the medications. But I think what you mean is actually using machines to pick and pack certain medications. Yeah, but so to answer this question, will the pharmacy profession be outdated? My answer is no, because you can never replace the human touch. So like the human touch is very important, and it's something that machines or automation cannot provide. So you also have to understand that the pharmacist, right, not only interacts with patients, but also interacts with healthcare professionals. And then there's a lot of like communication, there's a lot of rapport building with the patients as well. So automation can never build that kind of rapport with patients. And all of us will know that it's very important to build rapport with patients, because this will get patients to share certain information. Let's say like maybe they're taking certain medications, then if you build rapport with the patients, then they will tell you more things. Yeah, so it's a lot of that empathy as well, which machines just cannot do lah. So it's something that can never replace the pharmacy profession in this aspect. Yeah, but another thing to add on is pharmacists also don't only dispense medications, they also do many other things. So for example, we also do things like drug information. So we have different healthcare professionals and even the general public coming to us, like asking us questions like, oh, what's the dose of this medication, or what's the side effect of this antibiotic? Oh, my patient is pregnant, can she take this medication? Or like, oh, my friend is breastfeeding, is it safe for her and her child if she takes this medication? So we do have all these questions coming in also, and that's where the drug information pharmacists will come in. So in this sense, we will have to go and look at all the different resources, try and put together all the information, and then localize it in the Singaporean context and to that particular patient, and then build the rapport, build the empathy and everything, and then deliver all the information to the patient. So this is something that the robots, the machines can never do lah, because it's just lacking the human touch lah, basically. Yeah, so quick answer to the question is no, I don't think the pharmacy profession will be outdated.
Thank you, Joey. So maybe I'll just add on a little regarding the topic of some healthcare professions being outdated. So as a pharmacy student myself, I do see some parts of the pharmacy job scope in the hospital perhaps being replaced by robots and machines. However, one important task that actually pharmacists do is something called reconciliation. So it's part of picking out errors in the prescription and identifying any potential drug errors that patients have. So in present day Singapore, many elderlies are having multiple medications, something called polypharmacy. So there is a very high chance of medications occurring, medication errors occurring, such as different drug cannot take with this drug cannot eat with something else. And these are things that robot actually cannot spot, but you will need a pharmacist there to talk to the patient to find out what is wrong and then to suggest a change that will be best for the patient. Yeah. So if nobody has anything else to add, maybe I'll move on to the next question. So how do you know about your interest in the discipline before pursuing it? So I think it's open to all our scholars to answer.
I think I can take this question. So actually, I came from a business background. Yeah, so I was actually from business poly business, and then I work in a clinic part time. You know, just a normal part time with no special like because I want to go into healthcare. So because I was working in a part time for about 3 years, like almost my entire poly, and then it sort of exposed me to like the healthcare. I mean, even though it's just a normal GP, but there's a lot of like human touch and a lot of interacting with patients, which is what I really love. And then because of that, actually I took a gap year. So after poly, I took a gap year before entering uni. So now I'm actually a year 1 nursing student. So I took a gap year and then I went to work full time in my clinic to really see whether I really enjoy working in a healthcare setting, facing the akong amas, and sometimes it may be quite challenging, but then I guess it was like a calling. Yeah, so that's where I am, and now I'm pursuing nursing in NUS. So yeah, I hope this helps. I hope this short story of mine will inspire you guys to, if you guys need to take a break from after A levels or polys to go and really decide whether you want to pursue in a healthcare discipline, then go for it. There's no rush in these kind of things. Yeah.
Thank you, Elaine, for sharing. So any other our speakers would like to share their experience? So why did we choose our healthcare courses?
I think I can share because I always get this question like, how do you even find out what occupational therapy is? And mine is a very weird story. So basically, I had a teacher that was very close to me. She just came up to me one day saying like, you know what, Ingi, you look like you have the face of an occupational therapist. And like, that's how it started. So I think my advice is to ask around your friends and families because sometimes they have a better perspective of you as well. And after she told me that, that was when I started to research into like what is OT and what are the different types of allied health that are available that I can sort of try. So for me, I instead of Elaine who stumbled upon it, I actually had to go and search out different opportunities myself. And thankfully, I also managed to find an opportunity as an assistant for occupational therapists. And yeah, so after I did the experience, I also did realize that this is something that I really enjoyed and I could envision myself doing for like the next few years. So yeah, that's how I did it. I'm studying occupational therapy now. So yeah, if you are not sure, you also can ask your friends and families because sometimes you don't see yourself doing. They have especially people close to you, they can have a good understanding of you and can give you good recommendations.
Yeah, thank you, Amy, for sharing about her experience of taking out OT. So any other speakers would like to share about their stories?
Okay, maybe I just share for physiotherapy in general. I think people always have the impression that maybe you like sports, like do a lot of sports. If you are this kind of person, you will actually come into physiotherapy because it kind of fit that stereotype, and it's not wrong. I came from a sporty background, and I enjoy sports, but then actually what I realized was actually when I started studying and after my placement. So I just finished my clinical placement and I'm about to start working in a few months. But then actually I did a reflection at the end of my placement, and I look back like what was actually the reason that I chose physiotherapy. And then I look like at this current moment, it's actually a very different reason. And I think there's nothing wrong with that. I think as healthcare profession, as you progress through your journey, you realize that you will grow, and you reflect upon the journey and how you know, in terms of your mindset, how you change. So I think for me was just a very super. I would think it was a rather superficial reason, a very narrow-minded reason for joining physiotherapy initially. But actually, when I start work, clinical placement, and when I start studying some of the key modules, it was then I realized that there was actually a lot more to physiotherapy, not just the musculoskeletal portion, but also the cardiopulmonary, where you see like COPD patients, see pneumonia patients, and also from the neurobiology side, where you see stroke patients. So there's really a very broad range of disciplines that you can choose under physiotherapy, not just the musculoskeletal like sports injury. So I think for me, actually looking back, this question is quite, I think when I look at it, actually I did a reflection about it, and it's a very tricky question now, because the initial reason for joining physio and the current moment why I still have that love for physio is very different. Back then, I think I would think that when I join physio, next time I would want to maybe specialize in sports related with with athletes, But then actually I realized that at this point my interest actually lies in geriatrics and neuro patient, which is stroke patients and also elderlies in general. Even though I have that interest back then, but I think you just have you just have more emphasis. Like back then I was more a bit sports, but also elderly. But now I'm really full on elderly and also stroke lah. So I think there's nothing wrong with that. But I think is to always remember, to check on yourself. I think don't ever think that the initial reason is the reason at the end as well. Yeah, and I think that's how we grow in our respective disciplines lah. Correct.
Yeah, thanks Jonathan for his inspiring story of why he joined physiotherapy. So due to time constraint, we will now proceed on to the last two questions for the day. So do note that you can always find more information about healthcare scholarships on our website, healthcarescholarships.com.sg, or email us at talent@mohh.com.sg. And then we will make sure to get back to you. So now moving on to our last two questions. So perhaps we will talk about the question that has one of the many upvotes they have. So to scholars, do all of you have volunteering experiences, and how long was the volunteering duration before you apply for the discipline? Yeah, maybe I'll start first. So personally for me, for pharmacy, I did not really have many volunteering experience before entering pharmacy. Yeah, so yeah, the short answer was no long. Like it wasn't a requirement for the pharmacy requirement 3 years ago, but I'm not sure for now. It most likely is the same. They do not really emphasize much for the course itself, but for the scholarship application wise, anyone else want to answer?
I think volunteering probably it's not okay. I would think that it's not a requirement, or maybe if it's a requirement, it's actually to give you an advantage to help you understand how to interact with people, because interacting with your family members and interacting with people of different background is very different. And I think the essentially why they want to put it as a requirement is so that to really expose and allow the students or the future scholar to know whether this is something that they want to do. Because if say you don't go for volunteering and you just think that, oh, I want to be a healthcare professional, but when you come in, you realize that you don't really like to interact with people, or you just, it's a bit awkward, But then if you actually had that prior experience in volunteering and you overcome that before that, right? Then you know, oh, actually I am awkward initially, but I actually can overcome it. Then you realize, oh, I think I'm good at this lah. So after that is that growing phase. So I think is don't take it as a requirement, but I think to really give you that not enlightenment, but like to allow you to know whether this is something for you lah. Yeah.
Yeah, I think just to write on to what Jonathan said, I really think volunteering experience really help you to know more about the profession, to really see whether like, because sometimes what we think of the profession, like the stereotypes we hear and we see, right, might be very different when you actually like immerse yourself and like look at how people do the job. So personally, for nursing wise, I didn't really volunteer for any nursing related things, but I had some experience like volunteering at this place called Hua Guan. So interacted with some of the residents there and some residents at the elderly home. And I realized like I'm a person who likes to talk a lot, to like know more about the people that I'm helping. So I really guess that spoke to me and also was one of the reasons why I wanted to join nursing. And going to the hospital actually to accompany my great grandma during her visits, I really see how the nurses there work, like the different things that they have to do. That it's really a very interesting job, and every day there's different things, and you really have to use a lot of like critical thinking, etc. So I really think that these experiences actually helped me to open my mind to see like what I like to do, like how I like to communicate, and what these professionals actually do, like their jobs going on. So yeah.
Thank you, Elizabeth and Jonathan. So move on to our last question due to our time constraints. So it's a question that I believe our prospective healthcare students and scholars will have in mind, which is how do I actually prepare for the interview and how do I actually ace the interview for the scholarship?
I don't think there's a surefire formula. I wish I knew the formula too when I applied. I think just some important things is if you are interested really to research into what you're doing and into healthcare in general, like the healthcare landscape in Singapore, really think about why you want to do your particular profession. And hot tip, if you are doing a less known discipline like occupational therapy, a lot of questions the panelists will ask you is like, why? Are you sure? Why not this? Like, why are you so sure it's this? So you really need to think through and you really need to be able to envision yourself to be doing this for, the next 10, 15 years. You have to make that, ensure you have the reason why you will be able to do the next 10 years in this particular discipline. Yeah, so that's my only advice.
I think I can.
Oh, you go
Do
ahead.
you
Go
want to
ahead.
add on?
No, you go ahead. Go ahead.
Okay, I think for me wise, like in all interviews, I think most importantly is to be yourself, like really be your genuine self, because the panel, like the interviewers actually can feel if you are, putting a show or not being yourself. So I think ultimately it's really just being yourself and show them that yes, I want this discipline and yes, I'm really into this, and just show them that who you are as a person, and I believe that things will go well. Yeah.
I think I just want to add that passion is probably the most important factor. So you need to know what you're getting yourself into. You need to know whether you really want this profession or not. And I believe that if you have the profession, you have the passion, as long as you have the passion, then the interview will be fine. Because if you have the passion, right, you will do research. You will find out everything about the profession and you'll just be naturally very interested and you will know what you want and how you can contribute to the public healthcare sector. So as long as you have the passion, then nothing to worry about.
Thank you all the speakers for sharing. So I'm sure our participants will definitely do well in their subsequent applications and interviews. So unfortunately, we have come to the end of the Q&A session. Thank you all of you for your active participation. So like I said, you can always find out more information about healthcare scholarships on our website, healthcarescholarships.com.sg, or feel free to email us at talent@mohh.com.sg, and we will make sure to get back to you. So that is all for today and for this session. So thank you for all your questions and for walking in our healthcare professionals' shoes. And if I'm not wrong, later we have a session at 5 p.m. for P&O session. So do grab a snack, grab a coffee, and come back again. Thank you.
Sorry, just give me a few seconds. Thank you scholars for all the sharing or the insightful sharing. So for the polls that we have been conducting today, we'll go back and tabulate the scores and we'll be in contact with the top 3 participants. So we have a next session at 5 p.m. that will be Learn and Explore Prosthetics and Orthotics at 5 p.m. That will be with our overseas university, University of Strathclyde, and they'll share more about their course structure, entry requirements, and student life, and there will also be a mini lecture. So we look forward to seeing you in our upcoming sessions. Thank you so much. See you all.